Mr. Chairman, thank you very much. Secretary, thank you for joining us this morning on a hugely significant and unfortunately so timely topic. First of all, I want to highlight the hearing that our Appropriations Subcommittee had in April on this topic. But I want to remind you, Mr. Secretary, and I understand that Senator Murray has a question for you about VA follow-through on a commitment that was made at that hearing. It was committed by the VA that we would get monthly reports in regard to your efforts, the department's efforts to comply with the Inspector General's recommendations and failures at the VA in regard to suicide, and we have not received those reports on a monthly basis. I'll defer to Senator Murray, but I would join her in her request that what was promised would actually be followed through on. Let me then talk about another topic that Senator Tester and I have worked on. We've been trying for a long time, and in fact in 2010, now 7 years ago, gave the VA the authority to hire marriage and family therapists and licensed professional mental health counselors. The results of that authority have not resulted in any significant hiring of either one of those professionals. I would guess that Senator Tester and I are interested in this reason for the scarcity of professionals generally, but especially, as you were indicating, in rural communities. And so we have sought and have provided congressional authority for the VA to hire. You indicate you're in the process of hiring 1,000 additional professionals, but I would tell you that after 7 years, those two categories only account for 2% of the mental health workforce at the Department of Veterans Affairs. Will you, Senator Tester and I and others have a letter to you in this regard that was sent to you just a few days ago, but in this hiring, would you again commit to filling these positions with those professionals, something that has not happened? And if so, how many of those are going to be? What would your prediction be would fit an MFT or an LP MHC? And would you provide me with those numbers as you fill those positions? And I assume that there will be a priority given in regard to places that are hard to recruit professionals. I also know that you have hiring authorities that are difficult. I don't know what your expedited hiring authorities are. What are they? Do you currently, what do you have at your disposal? And do they apply to mental health professionals? What needs to happen to fix this problem? We've noticed so many times that the things that are having to be posted don't result in any kind of quick response for hiring at the VA. We discussed this topic with Dr. Stephanie Davis, who testified. She's at the eastern part of our Kansas VISN. She testified before our Appropriations Subcommittee in April. Jobs are posted on usajobs.com where applications can linger for 4 or 5 months. People find other jobs in the meantime, and it becomes even more impossible to recruit and retain. We know that positions set vacant for months or even years while providers go through the process of the federal hiring mechanism. What can you do to get that process expedited? And then finally, Mr. Secretary, I wanted to tell you that I was just earlier this month at the Phoenix VA, where I saw one of the pilot programs under Clay Hunt Act. They're called Be Connected. I was impressed. What this is about is having those who have similar circumstances, who have served our country, who are veterans themselves, who've had PTSD and other problems, as the counselors for those who are calling the number. And I'd be interested in knowing what the VA is doing to support Be Connected, and are there other plans? Are there plans to expand that program elsewhere?
A lot of questions, so I'm going to go really quickly, and anything that I don't do an adequate job on, I will follow up. First of all, on the issue that you talked about us not providing timely follow-up, and if Senator Murray is going to comment on that too. Look, that's unacceptable. If we say we're going to commit to something, my expectation is that we commit to it. So I appreciate you letting me know about it. I can assure you my staff will be knowing about that, but we will do better, and that's just not the way that I want the department run it. So we will make sure that you get that. On the marriage and mental health counselors, I'll look forward to the letter. I am aware that we continually hear about VA's strictness on our accreditation issue. This is particularly a training issue. Since there are 2 accreditation programs, we are committed to bringing on marriage and family therapists. If Dr. Carroll has any specific information on numbers, I would defer to him in a second. On the issue of hiring, look, it's the single most challenging thing that I know of in VA. It shouldn't be that hard to get people on board. In the Accountability Act that the chairman referred to that we passed together not too long ago, you gave direct hiring authority to medical center directors. That is really helpful to us. It allows us to skip over a lot of the red tape. I want that authority for all of our critical health professionals. I would urge us to work together on that. It's just too hard to get people hired into the VA.
So do you have the authority under the Accountability Act to do what you need to
Only under medical center directors.
Okay.
So if we could work on expanding that, I'd love to target it for mental health, but we have other health needs as well. So I'd love to work with you on that. And on the Be Connected program, peer support is something that we are really committed to. We think this works, particularly for veterans who understand what they've gone through. So thank you for your visit. Thank you for mentioning that, and that's something that we're going full force on.
Do you have other plans for that program elsewhere?
Yes, we already have about 1,100 peer support counselors, and much of our vet center model is actually based on that model. We know it works, and vet center growth has been continuing to go up each year.
Thank you.
I know Dr. Shulkin wants to be sure we point out, since the resident state of Senator Moran is Kansas, that the 3rd Mental Health Hotline Center is being
Yes.
set up in Topeka, Kansas, if I'm not mistaken.
You're absolutely correct.
We're delighted to have you.